Ozempic is everywhere. Celebrities, influencers, even your gym friends are injecting it like it's a vitamin shot. They call it a miracle, they call it effortless fat loss, they call it the future of fitness. But let's ask the uncomfortable question no one wants to answer. What if Ozempic isn't saving lives? What if it's slowly damaging them? Ozempic was never meant to be a lifestyle drug. It was developed for type 2 diabetes for people with serious metabolic disease. Yet today, healthy individuals are taking it just to fit into smaller clothes. That alone should make you uneasy. This drug works by shutting down your hunger signals, not controlling them, not improving them, shutting them down. Your body stops asking for food even when it needs it. And when you silence hunger, you don't just lose fat. You lose muscle, bone density, hormonal balance, and metabolic strength. This isn't weight loss, this is controlled starvation. Doctors are now reporting patients who look thinner but feel weaker, colder, exhausted, and mentally foggy. Some describe hair loss, brittle nails, constant nausea, and dizziness. Is that health or is that damage? Let's talk about side effects. No one puts in Instagram captions. Ozempic is associated with severe vomiting and dehydration, electrolyte imbalance, kidney stress and acute kidney injury, gallstones and gallbladder infection. Pancreatitis, a condition that can turn fatal if untreated. These are not rare inconveniences, these are medical emergencies. And yes, Ozempic carries a black box warning for thyroid tumors based on animal studies. That's the strongest warning a drug can carry. Yet people are injecting it casually, without long-term data, without understanding what it might do after years of use. Because here's the truth nobody likes to say. We do not know the long-term consequences of using Ozempic for cosmetic weight loss. You are the experiment. Another controversial reality, Ozempic destroys metabolic independence. Once you stop the drug, hunger comes back aggressively. Most users regain the weight, sometimes more than before. Why? Because your body never learned how to regulate itself. It was chemically controlled. So now to stay thin, you must stay injected. Ask yourself, is that freedom or is that dependency? This is where the conversation gets uncomfortable. Pharmaceutical companies are not charities. They profit from chronic users, not cured patients. A drug you must take indefinitely is a business dream, and society is normalizing it. Instead of fixing food systems, instead of addressing sedentary lifestyles, instead of teaching nutrition and strength training, we are selling injections. What message does that send to teenagers, to young adults? That discipline is outdated, that health comes in a syringe. Even worse, Ozempic is now being misused by people with eating disorders, pushing already fragile bodies toward malnutrition and psychological collapse. Doctors are warning about muscle wasting, including loss of cardiac muscle. A weaker heart doesn't show up on selfies, it shows up years later. Ozempic may help certain patients, that is true. But pretending it is harmless, universal, or safe for everyone is reckless. Medicine should reduce risk, not create new ones. Weight loss should make you stronger, not weaker. Health should increase lifespan, not gamble with it. And here's the most controversial truth of all. If you need a lifelong injection to stay thin, you didn't fix the problem, you postponed it. Ozempic isn't evil, but blind faith in it is dangerous. Before you inject yourself chasing a trend, ask, what happens to my body in 5 years? What happens when I stop? What price am I paying that I can't see yet? Because shortcuts in biology always come with a bill and the body always collects.